thanks everyone for inviting us to speak today. Justin and I are here to kind of give you some information and share some of the results from the Spectrum mobile app. So for anyone who isn't aware, Spectrum is a mobile app, an antimicrobial stewardship app that is free to download either through the App Store or Google Play. And so I'd encourage anyone on the call to download it right now and take a look at it if you're not already familiar. And we're going to go through some data regarding our study. So we received a grant. Our Saskatoon Antimicrobial Stewardship Program received a grant from the College of Medicine to study the impact of an antimicrobial stewardship mobile app in Saskatchewan. And we received funding for an 18-month contract to study Spectrum starting in April 2018. So let's start with a little bit of a background here. We know that anywhere from 30 to 50% of antibiotics being prescribed in hospital is felt to be inappropriate or unnecessary. And this is a study that I've put up here from 2003 that illustrates the reasoning for unnecessary or inappropriate antibiotics, usually being due to duration of therapy longer than necessary, treatment of non-infectious or non-bacterial syndromes, as well as treatment of colonizers or contaminants. So getting a positive culture from the microlab that's not necessarily relevant or reflective of a true infection. What we do know is that more than 85% of clinicians are now owners of smartphones and carry their smartphones with them to work. And more than 50% of clinicians are using smartphone apps and integrating that into clinical practice. So there's a grand opportunity here to launch antimicrobial stewardship mobile apps to try and tailor behavior, improve guideline adherence. We do know also that antimicrobial stewardship smartphone apps are used more frequently than paper pocket guides, and it's obviously much easier to tailor and edit the content and keep things reflective of resistance patterns as opposed to pocket guides and trying to reprint those year to year. So there is good evidence that antimicrobial stewardship smartphone apps lead to increased awareness of antimicrobial stewardship, self-reported changes in antimicrobial prescribing behaviors, as well as increased guideline adherence. So Justin and I recognized the impact of mobile apps and wanted to translate some of that information and incorporate elements of implementation science as part of a novel strategy. If we look at prescribing patterns in Saskatchewan, we know that Saskatchewan is the second highest user of antibiotics in Canada. And if we look at our resources across the province, our resources are quite limited when it comes to antimicrobial stewardship, both in terms of funding and in terms of personnel. So there is a strong need for local guidelines tailored to our susceptibility patterns and effective knowledge translation strategies and clinical decision support tools. So the objective of our study was to study the impact of an antimicrobial stewardship mobile app in the Saskatoon area of the Saskatchewan Health Authority. And as I said before, we received funding through a College of Medicine Research Award for studying Spectrum for an 18-month contract from April 2018, and that goes until October 2019. And so I'm going to hand it over to Justin, who's our lead pharmacist, and he's going to walk you through some information as far as what Spectrum does.
So thanks, Shaquille. So we know that we have a limited resource group and that we have obviously a high need or a high user of antibiotics in Saskatchewan. So what we needed was something that was quick and easily accessible that allows us to really touch on three main things. The first being, as is recommended by both IDSA, so Infectious Disease Society of America, and the Association of Medical Microbiology and Infectious Diseases, the Canadian group, you need to tailor all of your antibiotic suggestions to localized patterns. In Spectrum, we've been able to develop 20 local guidelines and pathways that reflect our patient population And along with that, we're able to generate our recommendations based upon not only our local antibiogram data, but also the resistant patterns that we would either expect to see or know that are occurring in the Saskatoon area. For a lot of these 20 local clinical guidelines, we've adapted treatment recommendations that you might not necessarily find everywhere else, but still we can stand behind it based on our local surveillance data. The other thing that's nice about Spectrum is it's one of the few tools that unites things from the micro side all the way down to the practical dosing side. And in our area, we've been able to adopt our local antimicrobial formulary and any respective dosing information that goes along with the drug selection. More particularly, things like when we have formulary that has certain drugs that are restricted by service, so say something is an ID service restricted drug, we're able to comment on the policies and procedures that are already established and really provide a one-stop shop on reflecting current usage and ways to access these antibiotics. So this is kind of a quick screenshot of the three main groups that you'll see off the Spectrum main homepage on your smartphone. The first one on the left is clinical pathways, and again, these are 20 separate ways and created by us and also reviewed by local experts. So it's not just Shaquille and I sitting in a room. It's we put the content out for commentary. People reflect on the applicability and whether or not it kind of meets the test for clinical application. And obviously, the nice thing about this is it allows you to incorporate choice and decision support right into your analysis. So patients can be graded according to their disease states or their presentation or their medical history. It also helps physicians decide things like diagnostics and sampling. So one of the few times you can actually incorporate what to do as well as how to treat it. The second column is pathogens, and this is a breakdown of all kind of relevant medical pathogens that allows us to show local resistance data and also kind of incorporate some elements of infection prevention and control. So we're able to have not only just pathogen information, which you'll see on that kind of general information tab, but we can also tie in what you would expect as associated syndrome. And in the additional information, we can include things such as contact precautions, screening, who to call for more information. So it really kind of expands your ability to analyze or really assess the impact of that bacterial species. The last column is antimicrobials, and I kind of got that, I went ahead of myself there. And this is based on our local formulary data and includes local dosing. It also incorporates some cost metrics. Will tell you which antibiotic is more expensive versus not. The other thing that I really like about this app is that as soon as you pick your antibiotic, you're able to get into the dosing section immediately. So based upon your patient, you can pick an appropriate renal dose, or in some cases, appropriate hepatic function dose. The other thing that helps our group out is that it kind of translates across many health professions. So physicians and pharmacists are able to dose and monitor more complicated things like aminoglycosides and vancomycin right off the bat at an appropriate dose. So if you expand into it further, for instance, looking at community-acquired pneumonia, this is kind of the decision support tree that's embedded right in it. You can use the CURB-65 score to assess your patient and their fragility and basically what their 30-day mortality is. And based upon that and our local epidemiology, you can see that you have some choices of treatment. Now, if, for instance, you chose amoxicillin clavulanate or perhaps chose ceftriaxone, that would take you right into the drug pane on the next tab. So there's this nice kind of cross-linking of all content that's presented in the app. Here's an example of the bacteriology results for one of our most commonly encountered Enterococcus faecium. And you can see the antibiogram data is reflected not only in terms of sample number, but also in terms of what our percent sensitivities are, allowing people to make a more appropriate upfront decision and or know when to call. In the cases of some other bacteria that might require further intervention, we can include warnings for those to say you need to consult infectious diseases right away. This is the last drug pane, again, localized to the former Saskatoon Health Region formulary. The other components that are reflected in the antibiotic section is assessment of what their C. difficile risk and how orally bioavailable the antibiotic is. So for those patients who are eligible for an IV to oral step down, people can consult this section and find out that, you know, the oral dose is relatively equal to the IV dose. I've already mentioned the vancomycin and aminoglycoside nomograms, adult dose information, and of course we can control our agents restricted to infectious diseases quite nicely. There's a certain element that really helps in that it allows clinicians to really have a good conversation and a good think about what antibiotics they're prescribing.
So a bit more information now in terms of how Justin and I kind of build the content in collaboration with our antimicrobial usage subcommittee. So with Spectrum, if a center chooses to adopt Spectrum, it's quite easy to migrate content into Spectrum, and some of that content can be adapted from other current trusted sites that have adopted Spectrum into their health authority or health center, and then we can basically adapt those algorithms. We can also take any sort of pre-printed order sets, and then Spectrum can also assist us to transform those guidelines into an algorithm and make sure that that looks good in the app as well. As Justin mentioned as well, one of the nice things about Spectrum is that we can adapt content and we can tailor content based upon user feedback. So for example, if clinicians wanted a pathway for a certain syndrome that we didn't already have, it's very easy for Justin and I to build a pathway and create one to make sure that we're appealing to our audience. So for example, we heard feedback from people that they wanted a pathway for candidemia. So Justin and I sat down one afternoon, looked at the guidelines and built one and had it approved by our antimicrobial usage subcommittee, and then have put that into practice as well to try and optimize guideline adherence for management of candidemia, for example. It's very easy for us to update content. Justin and I are able to edit content in the background and then decide when we're ready to push that content to be accessible by users on the app. And so it's very easy to update that as opposed to other antimicrobial stewardship apps where you might have quite a bit of a lag time for your content to be approved and pushed out to users. So like I mentioned, all of the content is very easy to edit on the web using a staging platform. And then once we're ready to push things out, updates can be instantly pushed out to all of our users, letting them know about updates and new pathways. Through Spectrum, we can also track who's using it. So initially, when you download our version of Spectrum, you'll be asked which hospital you primarily work at, your healthcare role, whether you're a physician, pharmacist, resident, nurse, medical student, and then we can track your usage to see different groups, who's accessing it and how often, to also give us some more data. The other really fantastic thing about Spectrum is that we can communicate with our users. So when we launch a new pathway, we can send a message out and a push notification to their device, letting them know that there's a new pathway for candidemia, for example, or for animal bites that they might want to check out. We can also send out notifications if there's an antimicrobial that's on back order. So for example, if there's a shortage of intravenous Septra, we can communicate that to our clinicians. And that also encourages more collaboration between clinicians, infectious diseases, and stewardship. We also had some fun with it too, and we did an antibiotic personality quiz to also do some kind of fun things with our user base as well. I'll show you some data regarding Spectrum usage in other centers before we show you our data. So what you can see in many other centers is rapid adoption. So on the left here, you can see adoption at the Children's Hospital of Eastern Ontario, and on the right, you can see adoption through Alberta Health Services in Calgary. You can see quite rapidly within weeks to months, very early from launching, you can see rapid adoption of the app and then sustaining that over time as well. Some data collected by Calgary regarding Spectrum shows very positive user feedback in terms of Spectrum improving the appropriateness of people's prescribing behaviors, as well as encouraging them to use local antibiogram data and the app itself saving them time. You've essentially created a central platform for clinicians to navigate and access evidence-based guidelines rather than trying to do a literature review or do a dig on the wards. They can easily access relevant information and then apply that into clinical practice. In terms of impact in Calgary, when they adopted Spectrum over the course of 1 year, they saw an overall decreased use of total antibiotics by 15%, with a cost savings of $500,000 over 1 year. So huge implications in terms of cost savings, and the cost of the app is insignificant compared to the cost savings that could be seen through adoption of Spectrum. In terms of Spectrum in the ICU, this is again data from Calgary, where they were able to show significant, close to significant decreases in anti-pseudomonal usage in their intensive care unit since adoption of Spectrum over time as well. These are all the sites that are trusted by Spectrum and have adopted Spectrum into practice. And it's interesting to see the number of sites exponentially increase over time. So I think when relaunched Spectrum, there were only about 8 or 9 sites. And this is just, as of today, the number of sites that have collaborated and aligned with Spectrum. So from the east to west coast, you can see a plethora of centers that have adopted Spectrum and are incorporating that into their practice. So some of you may also have heard about the Antibiogram app. And so what I want to do is take a moment to kind of compare the Antibiogram app to Spectrum, because often Justin and I are asked, what is the difference between these two apps? And so we have collected some data from the Antibiogram app and can share that to compare. It's also, I think, a good exercise because it's important to look at our current state, what resources we're providing for clinicians currently in Saskatchewan, and if there are things that we can improve upon. So in terms of comparing the Antibiogram app to Spectrum, the Antibiogram app itself only really provides you with Antibiogram data. It's basically collecting your Antibiogram data and just a central resource to store that data once your lab creates your Antibiograms. Spectrum has your Antibiogram data, but it goes well above and beyond that by creating local, customized guidelines, as well as pathogen and antimicrobial information, as well as the potential to have more interaction with your user audience through push notification features, and also allows for users to update content. So Justin and I can edit and update content and then push that out to users as well. And we can also collect lots of different data using Spectrum as opposed to the Antibiogram app, and we'll show you that as well. There's also a web version of our version of Spectrum as well that's easily accessible as opposed to using it on your smartphone. In terms of some analytics comparing Spectrum to the Antibiogram app, so this is data that we've collected that reflects usage of Spectrum and the Antibiogram app from April 2015 to March 26, 2019. And because the Antibiogram app can't allow you to differentiate geographic location, this is just all comers for both apps. So you can see that the number of times that people access Spectrum far exceeds the number of times people are accessing the Antibiogram app. And the majority of Spectrum users are Canadian as opposed to the Antibiogram app that appears to be more American in terms of their user base. The nice thing about Spectrum is that it has very high ratings and has received numerous awards through Accreditation Canada as well, recognizing it as a novel platform and knowledge translation strategy and improving antibiotic usage in Canada as opposed to the Antibiogram app. And like I mentioned before, our collaborators with Spectrum are very passionate about the work that they do and are constantly working towards updating Spectrum and improving upon this platform. So I'll hand it over to Justin to now start talking about some of the data that we've gathered here in Saskatoon.
So yeah, we've shown you kind of a cross-section of Canada and North American use, and you saw that it was started to being used by University of Oxford. Yes, that Oxford University. So why don't we tell you kind of more local? First thing I'd like to highlight is our app usage, and you'll remember the app usage graphs from the two previous sites that Shaquille showed you. And I think what's important to note here is if you look at the blue line, that's our active unique monthly users. And what you normally see in an app development environment is kind of a parabolic curve where you get this giant upswing and then people kind of forget about the app. We haven't seen that, and in fact this plateau shows sustained user engagement, and this has been now thankfully over a year's time. So people are continuing to use it, and that's reflected with the red line, which kind of shows you the number of daily sessions per user, and we're trending usually about 1.5 daily sessions per user. And how long do they spend? About 2.5 minutes. So we're not talking about a giant drain in terms of the time of day or in terms of spending their time elsewhere. And I think that's a pretty powerful thing when you think about it, that everybody's choosing to look at it for 2 minutes and a bit, and they're doing it at least one and a half times a day. It kind of lends you to realize how fast the content is accessed, as well as it doesn't necessarily take away from other activities. And really, I would suggest that by just kind of being able to delve in real quick, get your answer, and be done, we're adding to clinical decision support. One of the great things that comes with our app is also the ability to track where it's used and who uses it. We mentioned earlier what we can actually choose the type of profession that's engaging in ongoing app usage. And if you break it down by categories, it's nice to see that physicians and fellows or residents make up a large proportion. The second largest, though, also is pharmacists, and I think that speaks quite nicely to the kind of interprofessional nature that stewardship has to fundamentally work in. It allows two groups of people approaching the same equation from different sides to access the resources, and I think it's also reflective of how well content is united in those kind of three different panes between the baseline microdata, the drug data, which is kind of arguably pharmacist heavy, and then the diagnostics and patient evaluation section in the earlier section on the different syndromes. If you look at the map on the left, you can see that Spectrum has been adopted in not just Saskatoon, but the message has spread, and this kind of reflects ongoing app usership in Saskatchewan, and obviously this has continued across the Prairie provinces, with some people uptaking our content in Calgary and Edmonton zones, likely to compare, much like how we've talked about comparing and using other trusted sites. But you can see that northern Saskatchewan is having some benefit, as well as extension all the way down into the Weyburn Estevan area. So it does show that according to the types of clinical syndromes that are presented, we've got some wide uptake. The other thing we're able to assess is where people are looking in our app. So the top 3 indications are things that, interestingly enough, bridge the gap between hospital and community settings. So you see non-purulent cellulitis in both hospital and community. You see urinary tract infections in both hospital and community. And obviously community-acquired pneumonia, whether or not it's being dealt with in the community setting or necessitating hospital admission, that again is one of our top 3 accessed clinical syndromes. If I was to wonder where are people looking the most for bacteria, Staph aureus or MRSA, methicillin-resistant Staph aureus, is our number 1 most grabbed bacteria from that section. Second to that is Enterococcus, and then Strep pyogenes. Again, kind of reflecting some of those indications that we talked about in the previous slide. The other part that we've studied is what antibiotic are they looking at? So which dosing are they most concerned about? And this is based upon our user feedback or user access. And it turns out amoxicillin clavulanate, so which is a great drug and really covers off all those community-acquired infections, as well as a lot of hospital-acquired infections, is our number one, second to ceftriaxone, which is, of course, indicated in many of our recommendations. So the nice thing about this is it shows you that people are accessing each section, and there's a good kind of spread of what they're trying to get out of the app, referring back, I think, to that breakdown of the usership. So it's one thing to have to show that we've got people accessing content and where they're accessing content, but do they like it? And Shaquille's going to tell you about that.
So we launched a survey in about 9 months after launching Spectrum, and we pushed out a survey through the app as well as through emails to all SHA employees and University of Saskatchewan residents and medical students. And we surveyed them to find out their attitudes and perceptions towards Spectrum. And by and large, the feedback was overwhelmingly very positive. 85% of our respondents said that Spectrum saves them time. 87% said that Spectrum is easy to navigate. And 88% said that the content in Spectrum is very relevant to their practice. 87% said that Spectrum improves the appropriateness of their prescribing behaviors when it comes to antibiotics. 89% felt that it was useful, and more than 90% said that they would recommend Spectrum to other healthcare professionals. So very positive feedback that is also in concordance with other surveys that have been done by other centers in Canada with respect to Spectrum. And we had a really robust response rate of 182 individuals, which was nice to see as well for a healthcare survey. So it's nice to see that people are accessing our app and that they seem to like it and that they're subjectively reporting that things are improved with their prescribing behaviors. But what is the actual impact that we're seeing in terms of prescribing behaviors of antibiotics? So we looked at the usage patterns on our medicine units at Royal University Hospital, where we can see one of the highest groups and the highest uptake of Spectrum on the medicine units at RUH. And we looked at total and anti-pseudomonal antibiotic usage before and after implementation of Spectrum. And we found a nearly 25% reduction in total antibiotic usage and about 33% reduction in anti-pseudomonal usage after implementing Spectrum on our medicine units. These changes were largely driven by reductions in fluoroquinolone usage, ceftazidime, as well as macrolides. And so we're continuing to study ongoing changes in prescribing behavior, not only on our medicine unit, but in other units in the hospital, as well at St. Paul's Hospital, to see the impact there. So from our study, I think we can see that Spectrum has been widely adopted and used amongst healthcare professionals throughout Saskatchewan, both in urban and rural centers. We can also see a sustained usage over time with strong positive user feedback, supporting this innovative app as an effective localized antimicrobial stewardship tool in providing clinical decision support. Reductions in antibiotic usage also reflect its dynamic value as a knowledge translation tool to improve local guideline adherence and optimize the appropriateness of antimicrobial prescribing. So as we mentioned before, our research award and our funding for Spectrum will expire in October of 2019, and now we're working with the department and senior leadership to work towards creating a business model and hopefully funding Spectrum on a provincial scale to continue to build upon this innovative tool. Justin and I also want to take this opportunity to acknowledge different groups of people through which it would not have been possible to make Spectrum happen. So we acknowledge the antibiotic usage subcommittee here in Saskatoon, our Department of Pharmacy and Division of Infectious Diseases, as well as the Department of Medicine and the Department of Microbiology, as well as the College of Medicine for providing funding to our program to fund Spectrum for the last 18 months. And Justin and I are happy to answer any questions and have further discussion at this point. And my last plug, download Spectrum if you haven't already. It's free to download on the App Store, Google Play, and you can also access all of our data. We've now pushed out a lot of the data that we are publishing on the website as well, so you can access it on that link as well.
Hi, it's Denise Worker in the Ministry of Health. Shaquille, do you have any information on the penetration of Spectrum in other sites? And do you have a sense of, well, what was your denominator in Saskatoon, and what penetration you got in your 18 months?
Yeah, that is somewhat of a challenging question to figure out what is that denominator. So right now we're on average seeing somewhere between 700 and 800 active monthly users. In terms of like a central database, you know, there's lots of physicians who may not be prescribing antibiotics. So for example, maybe a radiologist and may not be prescribing antimicrobials. So I think it's a little bit challenging to come up with what that denominator should look like. And there's going to be fluctuation over time. With that said, when we compare our usage rates to other centers, we are certainly exceeding other centers. So we're definitely above what we're seeing in terms of Providence in Vancouver. And then for frame of reference, Calgary, that's had Spectrum for about at least 2 years now, they see, I think, on average about 1,700 active users. So as a smaller center, proportionally, I think we're on target. And like I said, there's lots of room to continue to promote this app and expand upon this tool.
Yeah, just for point of reference for pharmacists, because we categorize them in the licensing body, you have a pretty solid number of where we're at. It's about 400 or so, 430 licensed hospital, quote unquote, pharmacists. So if you look at our overall usership and see that about 23% is pharmacists, or sorry, 35% is pharmacists. Our penetration, I think conservatively, is at least 25-30% of our licensed group, just from the pharmacy perspective. Thank you for your time and listening to our presentation. We're happy to, if there's any questions, feel free to either email myself or Dr. Mohammed. And thanks again for your time.